In this lesson, we're going to discuss pregnancy and childbirth. We're going to look at early signs and symptoms. We're also going to look at baby development throughout the 3 trimesters. We'll also look at how to take care of your body while you're pregnant, as well as what happens after the baby gets here. Let's take a look. We'll start with early pregnancy signs and symptoms. Those can include a missed period, changes in breast, extreme tiredness, nausea, mood swings, constipation, and implantation spotting. Now, some women notice them, all of them. Some women do not notice any of them. And some women, after the fact, begin to understand, I was really tired or I was sick. Now, the nausea can happen at any point of the day. So some people notice that or call that morning sickness. It doesn't necessarily have to happen in the morning. That's a common one. Prenatal care. So prenatal care is whenever you first become pregnant. So you want to make sure that you are taking supplements that are high in folic acid. That is very, very important for brain development early on. You want to eat healthful foods. You want to limit caffeine. That is thins your blood and is not good for the baby. You will start to have regular doctor visits, blood tests, glucose testing. You want to make sure that you stay hydrated. And if you're currently smoking, you need to stop. The first trimester are weeks 1 through 13. Now, week 1 through 4, you're technically not pregnant yet. Those are the first 4 weeks of your menstrual cycle. So when women find out that they are pregnant, they usually find out in week 5 or 6. At 5 or 6, the embryo begins as the size of a grain of sand. That's how big the egg is when it first starts out. The heart starts pumping almost immediately, and the organs begin to develop. It isn't a C-shaped. The nose starts to form, toes to begin to appear. All of the organs are almost fully functioning within this time period, as well as male and female parts. In week 13, the risk of miscarriage dramatically drops. Urine begins to form in the embryo, bones harden, and typically the mother does not see nausea after week 13. In the second trimester are weeks 14 through 27. In weeks 14 through 20, the sex of the baby becomes apparent, but typically too hard to tell early on. Red cells are forming, the scalp and hair starts to form, eyes can slowly move, limb movements become a little bit more coordinated, and maybe the mom begins to feel them at that point. Pumping about 100 pints per day. Toenails are formed. Fetuses begin to hear. Eyes move to the front of the face. So before that, they're kind of on the side of the face, and then they start to move to the front of the face. The digestive system begins to work. They develop a protective coating to protect from the amniotic fluid. So just like when you're in the bath all the time or fluid all the time, you get wrinkly. Well, they have to preserve their skin, so they develop a protective coating. And at this point, probably around week 20, they start to sleep and wake regularly. Continuing on with the second trimesters, weeks 21 through 27, they are covered in hair called lanugo. They can suck their thumb at this point. Fingerprints and footprints are formed. The fetus begins to respond to the mother's voice. This is very, very important. The baby's lung begins to develop in week 26. So after week 26, the baby can survive outside of the womb. Prior to that, it is very, very unlikely because the lungs haven't developed enough in order to take in oxygen and do what the lungs are supposed to do. Also, the nervous system begins to mature towards the end of this. Here's the third trimester. These are weeks 28 through 40. They begin to control their own body temperature. Their eyes begin to open. They can kick and stretch and grasp. Red blood cells start to form bone marrow. By week 31, they have finished major developing, and the baby just has to put on weight. The baby is practicing breathing. They actually breathe in amniotic fluid and swallow it, and then pee it out, and it kind of filters through there. I know that sounds really gross, but we all did it. The lanugo, all that hair starts to fall off. The babies can detect light. The pupils begin to contract, which means they get smaller. The head starts to descend towards the pelvis, as you can see there in the bottom picture, waiting for delivery. And then a full-term pregnancy is considered 40 weeks. So just a little bit of a tidbit here. This is my son Nolan. When he was first born, he was 33 weeks. He was only 3 pounds. So I know you can't tell right now, but he did still have some of his hair on him. And he is very, very small. So he did not have all of his organs developed, but he did not gain the weight that he was supposed to. He had a little bit of a stay in the NICU, as well as my daughter Ryan. She was a little bit bigger for 4 pounds, but her lungs did not develop as well as Nolan's did. So she had to be on that little breathing machine, lots of cords and stuff like that hooked up to them in the NICU. So there are 2 different childbirths. There's vaginal childbirth, which is here. You can see here opening. The child descends downward through the vagina. And then you have a cesarean. So you can see here the mom is cut open and the baby is retrieved from the uterus there. Drugs and alcohol, they are going to affect your baby if you do them during pregnancy. You are at the risk of a miscarriage, a stillbirth, which means that they are born not alive, a low birth weight or premature birth, which would then result in a NICU stay. Other birth defects, SIDS, they're a little bit more likely to have SIDS, which is a sudden infant death syndrome. Sometimes children wake up, the mom goes in there to wake them up, and they are no longer breathing, and it's a mystery. The baby can be dependent on the drug if the mother is using drugs while pregnant. It can cause brain damage as well as deformed limbs. Promoting health for the baby. So once the baby has been born, hopefully you stopped smoking while you were pregnant, and you want to continue that because it can be bad for the baby. You'll have to take the baby in for many doctor visits and bathe the baby, talking to the baby, playing with the baby, and feeding the baby. 2 choices here are breast milk and formula. There's such a big push for breast milk that they think formula is bad for the baby. It's not bad for the baby. It's definitely feeding the baby. So that's definitely important. And you want to listen to the baby tell you what they need. Something else I want to bring attention to is called postpartum depression. This is a depression that occurs after childbirth. It happens more than 3 million women per year. You typically resolved within months, but some of the symptoms can be your mood changes. You can be very angry or be very anxious, guilt or hopelessness. You can have loss of interest, mood swings, or panic attacks. Your behaviors can change. It could be where you cry a lot more, or you're irritable or restless. You could have depression or fear or possibly repeatedly going over thoughts. And so that happens a lot of time, I think, normally with moms. So when you have a heightened sense of that definitely needs to raise some red flags and talk to a doctor about that. Your whole body can be fatigue or loss of appetite. You can have lack of concentration or unwanted thoughts. Your weight you could gain weight or lose weight or have insomnia. So if you experience this or know someone who has, you definitely need to encourage them to go talk to a doctor about this, because it is very important that they see someone and get the help that they need. This has been a growing thing in our country, and we want to put a stop to it. I hope you learned a little bit more about pregnancy and childbirth. Be sure to answer your questions following this lesson.